Welcome back to Sports Medicine on Tap. My name is Brandon Online. I'm sitting at Neck of the Woods Brewing Company with my good friend, Dr. Frey. Dr. Frey, good evening.
How you doing, man?
Good. And our returning guest, Dr. Brian George. Dr. George, welcome back. It has not felt like it's been over a year since we last talked, but
no, it doesn't. It's good to be back. Thanks for having me.
According to our records, it seems like you haven't been here in over a year, which is crazy.
I was shocked, but we have slowed the pace of our shows.
Yeah.
Right.
Yeah.
We were cranking them out for a while, and I don't know.
It's harder now to kind of grab the content and stuff because one, we've done a lot of episodes so far. We've covered a lot of injuries, and we're going to touch on some repeats tonight.
Of course, it's inevitable.
And our busy season is football when there's a lot of activity every weekend, and you have a good report system.
I will say this time of the year is pretty good sometimes because like basketball playoffs are happening, hockey playoffs are happening. We're into the finals on both.
Yeah.
Baseball's going on. There's oftentimes there are a bunch of things going on, but we seem a little bit dry injury-wise, which is good for athletics.
Yeah.
Other than baseball pitchers.
Yeah. Yeah. So we're going to take
hand and wrist and elbow.
Yeah. So before we go ahead and go take a deep dive in all this fun stuff in regards to hand and elbows tonight, we just want to give a quick shout out to Virtual Orthopedics and Spine. We are sponsored by them. They have you covered from runner's knee to dog walker's hip to yard work back and laptop wrist. They have a doc for that. So find the right specialist for you at virtual.org/ortho. So tonight, when I was setting up the outline for tonight, I had Dr. George coming on. And I was like, let's just find as much hand and elbow, wrist related things that I could get. Based off the nucleus of this idea was, again, we're a little Philly based. Bryce Harper goes down with an elbow contusion.
Always influences our decisions.
A little bit. He goes down with an elbow contusion, getting hit by a pitch. On the 27th of May, he was out for 5 games with a contusion. He returned for 3 games from the June 3rd to the 5th. And then on the 6th, he gets put on the IL with wrist inflammation and soreness. And per some of the articles I found, this is an older injury that happened to him last year as well.
Right.
He's had this nagging chronic wrist injury, and now he's on the IL, and that's all we kind of have.
Yeah. So going back to last year, trying to remember last year, easier said than done, right?
Yeah.
He lit it up early in the season and seemed to taper a little bit down the stretch, second half of the season. And it seemed like he's been alluding to the fact that this was an issue for him through part of the year, and maybe impacted that. And I guess he had gotten through it, the pain had gone away, and then not very long into the season, this season it started coming back again, and then like the elbow injury, like you said, right? And then however that flares it up, and now they're like, all right, we'll shut. Seems strange, right? Like he has this elbow injury. They shut him down for a little while. It's like when I say the elbow injury, he gets hit in the elbow by the pitch, right? And they shut him down for a little while. You would think they would just if his wrist was bothering him, roll that injury into this wrist injury and especially if they were quiet about it for a while and just not really say anything. But they brought him back for 4 games only to pull him back out again. I don't know. It just seemed odd.
Yeah, it's just an odd kind of timeline of things.
Right.
Like you don't want to see him go out with one thing and then be around for a couple days and then, this old thing just decides to flare up.
I've been dealing with this for a year, by the way.
Yeah.
What? Our first question for our specialist here, right? What in the hell could it be?
So, I mean, I've seen his recent interviews, and it sounds like this was nagging most of last year. And I think the question you have to ask yourself is, well, why? What happened in the offseason?
Right.
And I think logic would dictate that when he's not playing and not throwing and not batting, it doesn't really hurt.
Yeah.
Right? And then when he gets back, so maybe he got hit in the elbow contusion, he's out, elbow gets better, his wrist feels better.
Right.
He hasn't played in a couple weeks, and he gets back. And
well said.
He's batting. I doubt it's the throwing as a first baseman, but it's probably the batting. So when you look at, we don't know exactly, and they're calling it wrist inflammation, which is a very generic term.
So couldn't be more vague.
When you look at what baseball players get in the wrist, they get TFCC injuries.
On my list to ask you about.
So TFCC
what is
stands
that?
for triangular fibrocartilage complex, which is on the ulnar side or the pinky side of the wrist. It's a piece of cartilage that sits between the wrist bones and the forearm bones, or the ulna. And when you're loading or you're heavy gripping and you're swinging the bat, and there's a kind of an ulnar deviation force and a rotation, you can tear that. And I use this analogy with my patients all the time. This type of cartilage is exactly the same with the same problems as the meniscus in the knee.
Yeah, like a little bitty meniscus.
Yeah, the central part has no blood supply.
Yeah.
When it tears, it just stays torn.
Yeah.
Hopefully you get better. The peripheral or edge part that's attached to the capsule can heal over time.
Yeah.
But that is common for pitchers. They also get, tendonitis of the extensor carpi ulnaris, also on the pinky side of the wrist from the similar batting and repetitive use. If they get hit by a pitch, you can get a hook of the hamate fracture. That's common, but you would know. I mean, I think you would know that and treat that because that's not going to get better. Those go on to very commonly go on to non-unions, or the fracture never heals and they have to be addressed. But just watching his body style and grabbing the wrist, that does not look like what he has.
And if it were that, like they would have treated that
they would have treated
last year,
they would have treated
off
all
season,
season.
right?
They would have treated
that
it
would
in
have
off-season.
been. I mean, because we think we covered. I believe Mike Trout had that a year
Yeah.
or two ago.
Yeah.
when
Yeah,
we kind of
I think I had Dwyer on there for that.
Yeah, I think we did. But that's something that's very common in the world of baseball.
Right. But that's something you treat, right?
Right,
I mean,
right,
you treat it in
exactly.
the off season, and so I don't think it's that. And then they can
generous.
also get scapholunate ligament injuries, a very small ligament that holds two of the wrist bones together. That's usually from a diving. You land on your wrist. Again, if that happened, something you don't really let go too far. You don't let them play with it. So extrapolating the information that I have, it's probably a TFCC injury or extensor carpi ulnaris tendonitis.
Yeah. More of an annoying type thing.
Yeah.
Right.
But certainly the more you use it, and batting the way if you look at the batting mechanism, when he's rotating his wrist, ulnar deviating, grabbing real hard, loading the wrist, it's probably aggravating it.
Right.
So, you see the video of him getting hit by the pitch and then he grabs his wrist hurts.
Right.
I don't know maybe he just, the way he jerked his wrist back, maybe it just caught it in the right position that it hurts.
Is there any chances, in any way, shape, or form, like escalopressy, like syndesmosis?
No, I mean, I doubt
neurosis,
it. I mean, I'm sure he's had the workup of workups, including MRIs, escalopressy or kind of an injury of the ligaments or connective tissue between the two bones. I mean, that's usually from a trauma. That's usually from it's not repetitive use. You don't really get that with repetitive use. That's usually an acute trauma. So
the only reason is like he gets hit in the elbow and that flares the wrist. Like it's
that doesn't. I mean, I know. I just watched his recent press conference or when he was interviewed. He's like, I get swelled in the elbow and then it made its way down to the wrist. I'm like, I don't know. I don't know.
Is that how it really works?
I don't. Yeah, right. I don't know if that's how it really works.
And I think it's interesting too, right? Because going back to diving into his history a little bit, right? Like we know that he had the Tommy John surgery a few years ago on the right side. He's a right-handed thrower, but he bats lefty. So his right elbow is the one that's in front, which got hit by the pitch, and his right wrist is the one that kind of follows through with the bat and is in charge of all that ulnar deviation when he's batting all the time. Yeah. Which kind of like what you were talking about.
Right.
And it's interesting, like, I don't know, my brain's like, if he got hit in the elbow, his elbow could be like hypersensitive just because of the previous surgery and stuff, but I don't think that would be like, oh, now the wrist is a problem, or like, I don't know.
The wrist extensors do come off of that lateral side.
Sure.
Like.
Yeah.
So if he did have like a tendonitis issue, and then he has the proximal portion of that structure, if you will, is now inflamed and contused and bruised.
Maybe.
Is it causing more stress on the system? And then he goes back and swings for however many swings he takes in those 3 or 4 games, and then flares everything up. It's like, too much too soon. After going from playing regular injury, but that couple days of rest could have messed him up by then trying to ramp up too quick.
Is there any chance it could be like one of the kind of like the weird ones, like a radial tunnel syndrome, or like something along those lines?
I mean,
a nerve issue, that like the nerve getting squeezed or pinched and just getting hit in the right or wrong place, with a ball or something aggravates. I'm reaching here because not a lot of it makes sense to me.
Right. It's yeah. I think if you're letting the baseball hit in the elbow cause wrist pain, I think it's anything you're looking for is going to be somewhat of a reach. I don't
Yeah.
I don't really do put that as a cause effect, other than maybe when he was jerking his elbow back, he twisted his wrist in such a way that it got worse. I don't know, but radial tunnel syndrome or compression of your radial nerve up against your radius, it's a couple inches down from your elbow.
Yeah.
I guess you could have got hurt, but that would something that would get better. If it was a contusion of the nerve, that would kind of heal on its own.
Right.
If it was chronic, then that's a much bigger problem.
Right.
Right.
Much like what we're going to get into in a little bit,
Yeah.
the lateral epicondylitis.
Yeah.
Yeah. So I think we can drive right into it because, again, like we've mentioned a bajillion times on this podcast, we don't have access to Bryce Harper's actual medical file. This is very much a speculative discussion about what's going on based with the little bit of information we have. Like we gave you everything we got from the sources that give us most sports information in regards to this stuff, and that's the best we have. So that's
But then what do you do about it? I guess is the question.
right.
And sometimes rest is the answer. Like you know what I mean? Like I don't know.
I mean, I don't know what you tell your patients with meniscus injuries, how long to rest in hopes that a small meniscus tear will heal on its own. But it's a long time.
Actually, I say typically it doesn't heal. Like the symptoms might go away, and that's what we're hoping for you.
That's what you're hoping for.
Right. Yeah.
But it's a long time, and I tell my patients with TFCC injuries, I mean, this could be 6 weeks or 6 months.
Yeah.
Hopefully, you just notice it's slowly getting better.
Right.
But they're not swinging a bat 100 times a day.
Right.
So,
And if it's TFCC, usually that's diagnosed. Right? You can.
it's surprising how often it's not diagnosed on MRI. I mean, I imagine MRIs span the spectrum of quality, right? And a good quality MRI can, the sensitivity of a good quality MRI is still about 85% sensitive to pick up a TFCC tear.
Right.
So it could be missed, and it could be caught. I mean, but what do you do about it?
Yeah.
Right.
Yeah.
I mean, if I
scope
MRI
it,
both of your
debride it,
wrists,
repair it.
I can MRI both your wrists and it shows TFCC tear, but you have no symptoms. So what do we do, right?
Leave it
So back
alone,
to your maybe you just let it rest and get better, and that's probably. I mean, again, I'm reaching very far here.
Of course,
it probably got better in the off season when he wasn't using. Like, all right, great, we're good to go, and then it came back. Like, oh no, now what do we do?
Yeah.
Like if you do if you do scope, if you do surgery, then he's out for a long time.
Season's probably done, right?
Well, at this point, probably done. I mean, if he gets early July, I mean, the season's done. Maybe if late October, if you can make it that far.
Right.
But it's not great.
Right. Yeah, that makes sense. And again, I think now I don't know where I was talking to, but would you rather get an MRI for a TFCC, or would you even investigate it or go down the rabbit hole of doing like an arthrogram for it?
So MR arthrogram would be the gold standard.
Okay.
Yeah. But even that is not perfect.
Right.
I mean, it's such a small tear. It's just hard. It's not perfectly visualized on the MRI. It's such a small structure. It sometimes gets missed. I mean, I've done plenty of surgeries on negative MRIs where I go in and I'm surprised at the size of the TFCC tear.
Yeah, I know exactly what. So I'll equate that to maybe there's something called a ramp lesion, right, in the knee. You see that sometimes fairly frequently with the 20 ACL, and then you get this tear. Usually it's the medial side. You get this tear of the meniscus where it peels away from the capsule. It literally is like 50% of the time that you see the tear on the MRI, it's not actually a tear, and about 50% of the time that you don't see the tear on the MRI, it is a tear.
Exactly.
So their predictability is like 0%. Like they get it right almost never.
Exactly.
So I get where you're coming from, and that sometimes sometimes MRI is not the best test in the world to pick something up.
Yeah, and I think that concept alone is just something that's like a hard thing for patients to grasp a little bit of. Like, no, your MRI may or may not show something, but it's
like what? Yeah.
And I was talking about this with one of my colleagues earlier, and we were saying it's like, it's weird because like pro sports set this weird standard of like what their business model is kind of trickles down to everyday medical practice for folks like us who treat the general population who don't need an MRI for X, Y, and Z, but you see a report of someone, has a hamstring injury and they're getting an MRI tonight or whatever the case is, and then everyone's just think you need an MRI. I got to get an MRI. It's like, well, your injury or your clinical presentation does not equate to an MRI.
Yeah.
But the pressures of the world of
Yeah,
like,
yeah.
oh no, but so and so, whatever, got an MRI for this thing. I need an MRI too. And it's like, then you get it, and then you find something,
Yeah.
or you don't find anything,
Yeah.
and it's like, well, here we are.
Yeah, and then you run the risk of overtreating something that's
Right.
not
Yeah.
symptomatic. Yeah,
Yeah.
yeah, for sure. I'm kind of curious, actually. Not totally off topic, slightly off topic. If you were going to treat surgically, if you're going to treat a TFCC tear surgically, right? Like we were saying, there's really two options there. Typically you're going to scope the wrist, and then you can either trim the tear or repair the tear. Very much like a meniscus in a knee.
Exactly.
Now, when you're scoping the wrist, has basically a nanoscope, like the mini scopes, those tiny needle scopes? Because as it is, the wrist scopes are pretty small, but has that has that invaded that world? I would think that would be a perfect application for that. Do you even know what I'm talking
Sure,
about? Sure,
absolutely. Yeah. I've used the nanoscope, but the reality, if I'm in an operating room setting where I have a full high definition scope set, I mean, I still use a small 1.9 millimeter.
They're tiny,
They're 2 millimeter scope, but
right. I think that's what the nanoscope kind of is anyway.
The Nano's 1.9.
It's 1.9.
I think it's
so
1.9.
You're not getting.
I can. Unfortunately, the instruments to repair or shave are much. I mean, it's like a 2.5 shaver.
Right.
So, if you're going to use I use a slightly bigger scope to get a better visualization.
Does
but
make
no,
sense.
it's a good point. But and it is a good, not something I would do in the office, however.
Sure. Yeah. Understood. For sure.
Yeah.
It's changing the way we do things, right? Like smaller incisions, like even in the OR, and the pictures are getting really good now. And yeah. Anyway, I don't know. All right.
I think that's all pretty good points. I'm going to briefly touch on, again, Philly-based stuff. We had last night Bryce Harpers hyperextended an elbow on swinging the baseball bat last night in the lineup. He was taken out towards the tail end of the game. I thought it was interesting because there was speculation he would or wouldn't play, but the game's on behind us and he's in the lineup. He's playing. He looks okay. But what was interesting is that in the articles I was reading a little bit, he said he had a history of a nagging nerve injury last year that, is what he was being real cautious about the elbow kind of deal. And he said he kind of didn't blame his offensive struggles last year but he kind of alluded to that he was having this nagging nerve injury in the elbow. And then he goes and hyperextends it last night, and everyone was kind of like up in arms a little bit. So I thought it was a little interesting, but it seems to not really be hindering him too much.
Hopefully, yeah, not a real impactful injury.
Right. So again, just wanted to breeze on that one. But then the next big one is going over to New York with the Yankees. Giancarlo Stanton made his season debut last night for the Yanks. And he went 2 for 4 in his first game back, but he missed the first 70 games with bilateral lateral epicondylitis.
Right.
I think we touched on it very briefly towards the tail end of the year last year, going end of the playoffs. Apparently he was dealing with it all for a good amount of last year. Pushed through the playoffs, did pretty well in the playoffs for the Yankees last year.
Yeah.
And then once January rolled around, the Yankees shut him down completely and said no baseball related stuff, and they rehabbed a bunch and they put him on the 60-day IL, and then now he's back and missed the first 70 games of the year.
My gut reaction when I hear that is baseball players, right? But I saw him take a fastball in the face, and I'm like, he's probably a pretty tough guy, actually.
I would imagine he probably missed less games from that than he did with the elbow.
No, that orbital fracture, that was a big deal.
Yeah.
That was pretty gruesome.
Yeah.
But lateral epicondylitis in a third of the season,
just the timing.
It doesn't
sound
seem to
right.
What are your thoughts on that?
Better known as tennis elbow or lateral epicondylitis. I mean,
better known as tennis elbow.
It runs the gambit in patients. I'm sure you see it.
Yeah,
I mean, everybody
for sure.
sees it.
And sometimes people are miserable.
I mean, the quoted numbers of people who get this are, it's 1 in 7 or 5 in 1,000 or whatever. It's low, but I'll tell you, and it seems to be about half the patients I ever treated get this. It's usually non-traumatic, insidious, slow onset.
Yeah.
And I mean, it could be devastating. I have people that can't sleep. I mean,
really?
Severe pain. I mean, the number one, I mean, I know when I go into a room and patients describe it and they're like, I can't pick up a cup of coffee. I'm like, I know what you have. You have tennis. I mean, it's all, I'm like, I get it. It. I know you're trying to tell me how bad it is. And that's what it is.
Yeah.
But it can be quite severe. I mean, I've had some real, it's just from my philosophy, if you're losing sleep because it's so bad, then that's when treatment like cortisone injections come into play, even though the data on those are not great.
Right.
But yeah, it can be quite severe.
Yeah.
And if you're doing something repetitive like baseball, throwing, hitting, I mean, it can really limit you. And baseball players being baseball players with, their superstitions and other things.
Oh, yeah.
Right.
If your elbow's hurting a little bit and your game numbers are dropping, you're like, this is it. I gotta get back. I gotta get back to 100% before I can play.
Yeah. Yeah.
But it can be. I mean, I don't know if either one of you ever had any symptoms like that, but I've had mild and
me too. I would say a little bit mild here and there.
It can be quite painful and limiting to your daily activities if you can't lift a cup of coffee.
What do you have to say to the patient that comes in and says, like, I got an MRI, my tendons are torn? Yeah. So you take on that.
Yeah, every MRI kind of shows the same thing. It's it's always read as tear of the common extensor origin at the lateral epicondyle, which is what it is.
Right.
It's I always describe it as it starts as a micro tear, which kind of goes on to kind of burn out over time or just. So yeah, some people come in with MRIs. I don't normally order MRIs because our previous discussion, it doesn't change my treatment at all. Unless you had a bad injury or a car accident or a fall. If my concern is not that you ruptured a ligament or a fracture, then I wouldn't get an MRI because your MRI could show the worst partial tear I've seen. If your symptoms are getting better, then that's
just leave it alone.
Just continue what we're doing. But yeah, like we just said, I mean, people hold on to their MRI findings and they own them. So, but yeah, I try to treat symptoms. So it's always a tough conversation because when it comes to lateral epicondylitis, we do not have the greatest treatment.
Right.
I know we're going to talk a little bit about treatment options, but
that's where we're headed next. Yeah.
I mean, I normally give, you can wear various types of braces like the tennis elbow strap or wrist brace. You could give a home exercise program, therapy, physical therapy. I'm a big proponent of physical therapy.
Yeah.
And then you get into, besides activity modification, injection types.
Right.
Cortisone, PRP,
right.
And then more invasive procedures, which we tend to hold off until we've tried something else.
Right. So with that said, right, like based off just his injury, is like father time against Giancarlo Stanton a little bit, right? He's 35 years old now.
Yeah.
He's primarily playing DH for the Yanks, to my knowledge, right? So I wonder if that plays a factor, right? Because he's not active during the whole game, right? He's not playing outfield like he did in his younger years or whatever. So he's sitting, going up, swinging a couple times, sitting back down. And that up and down, I wonder if that has an effect on, baseball games, 2.5 hours. Yeah. And you stand up there, I don't know, 3-4 at bats. So you're only busy for, 20 minutes out of 2.5 hours. And
at the most.
At the most. Yeah, and you're not, how do you keep yourself warm and ready to go? And then if that, tendons, if they feel like tight or you're just kind of cooling down, then you go swinging a couple of times and it flares up again. And I wonder if that has any factor into this, issue for him.
Yeah. I don't know. Is it a factor? The fact that he's coming in cold?
Like older
and age.
I use another analogy with a lot of my patients, the hamstring pull, right? Mm-hmm. And I always say, why a lot of professional athletes retire in their early 30s? Because you just can't recover. Mm-hmm. Like you see someone in the preseason NFL pull a hamstring and they're out months.
Yeah.
And you're like, why? I pulled a hamstring in high school. I was back 2 weeks later.
Yeah.
And so it doesn't, and in baseball, because it's so repetitive and so long.
Yeah.
You just can't recover game to game. I think that's why NFL players don't make it that long, except for quarterbacks who don't really get beat up.
Right.
But the recovery from a week is not a lot of time to recover, especially in your 30s. When you're 22, you can recover week to week. When you're 35, you cannot. I'll tell you from experience, but you just, I mow the lawn too long. I got to take a couple weeks off. I think I'm a big proponent. This is non-science based, but your recovery really drops off after your like mid-20s, I think, in your late 20s and early 30s. You
Yep.
need a big amount of time.
I'm watching baseball as like a kid, as a teenager, whatnot, and being like, how does anybody get hurt pitching? Like, I don't understand it. Like, you're just throwing a ball. Like, how does anybody get hurt? And now I'm watching, like, how can they get through a full inning? Because like you just
So
view it
much
through a different
throwing.
lens.
Yeah.
You're like,
Yeah.
how does that not hurt? Like how?
Or like the guys who come like out of the bullpen and they throw back-to-back days. Or whatever.
Yeah.
How do you do that?
How?
Like,
How
what
do you do it?
Yeah, I go on the boardwalk and try to throw on that speedball thing, get up to 45 miles an hour. I'm like, I'm not going to move this arm for about 3 weeks.
We're done.
Yeah, that's just how it goes. And so it's interesting. And he came back. He seemed to do well.
Right.
I think on the report, like he took a real heavy focus on getting high velocity batting practice. He needed to really make sure he could hit contact with the ball and not have any issues. And I think he did decent per some of the reports last night. I didn't watch the game, but 2 for 4 ain't bad.
No. Welcome back. Like,
Yeah.
we're already making an impact.
You're right, exactly.
I will say, when it comes to tennis elbow, I've kind of deferred to some extent some of the 10 jet type stuff. And
Yes.
I don't know if you've been referring anybody.
Absolutely,
For
a
that.
ton.
Yeah. And then at this point now, how often do you find you're doing a surgery for lateral epicondylitis?
So I try to, it's a last resort.
Yeah.
You first of all have to have symptoms for almost a year.
Right.
I'll shave it off a little, 9 months or something. And you've also had to try a lot of other stuff.
Right.
But I always quote, I'm like less than 5% of patients. And it's usually, we're talking about sports players who can't, but in my world, it's guys that can't lay off. They can't do any activity modifications.
Right.
Construction workers, mechanics. They're
Yes.
like, well, if I want to take 12 weeks off of work, that's great. And then I'll lose my house. I'll lose my son.
Right. It's just not an option.
So it's not an option. So those are the guys that get, but here's the problem. The surgery's not great. The recovery's really long.
Yeah.
And
Yeah.
the ultimate results of pain relief are not great.
Yeah.
So, but less than 5%.
Yeah.
Get.
It's a pretty small number.
Yeah. You'll talk to surgeons that say they never do surgery. They just won't. They don't do it.
Yeah.
They'll also say that their patients always get better, but yeah.
That might mean they just move on to another doctor.
Right, maybe. Yeah, so I do it. If you look at my numbers over the years, it's probably 3 a year maybe I do.
Right.
I don't know. And I see a lot of tennis elbow. And
Right.
most everybody, if you look at the data,
Yeah.
the data says pretty much everybody gets better in 6 to 12 months if you do nothing.
Yeah. Just give it time.
No intervention. Just give it time.
Yeah.
I use the term burns out. It burns out over time. It just the pain goes away. Does anything change? Well, we don't know. No one has ever gone in and looked at your tendon after your pain goes away. Because
Right.
why would they?
Yeah.
So I don't know, but the pain goes away. That's what we know.
Yeah.
So
From a surgical standpoint, and maybe this drives the point home a little more. All right, the 2 guys a year that you want to do surgery on, what are you actually doing in that surgery?
So the classic surgery or the inertial procedure,
Yeah.
and what they try to do in the ultrasound guided procedures like the 10 jet
Yeah.
or the 10X,
Yeah.
they use an ultrasound to find the tendon. Although the MRIs always describe the common extensor origin, classically we learned it's the extensor carpi radialis brevis. It sits on the front edge of your lateral epicondyle, and so the traditional surgery, when you go in there, the tendon is it looks snotty. It's just not good, not healthy. So you would release it or cut it off of where it attaches to the bone, and then any pathologic looking tissue you would just remove
Clean it
and then clean it up. Yeah. And I did that for a while, and I recently, in the last probably 3 or 4 years, changed to trying to repair something back.
Oh, really? So you put like an anchor in? Or
I put an
anything?
anchor, and just because, if you look at here's the problem. When up to 25% of people who get operations still have pain, that doesn't, I always say that's terrible. It's from a surgical
That's not
outcome
great.
standpoint,
Yeah.
it's horrible. So it doesn't sit well with me. So I did it for, 8-9 years, and then I tried something else, and I
Right.
think I had a good outcome. So I'm like, oh, this is what I'm going to do now. Yeah. And so now I repair it with an anchor after. Has everyone gotten better? No, of course not. It's just, that's
Pretty good.
so I release it, and then I grab what else I can, and I suture it back down.
So that was always part of the issue that I had, like just like you're saying, a lot of it doesn't make sense, right? you do this MRI, it's red as a tear. You open it up, you look at it, and the tendon looks like junk. The tendon doesn't look great, and it's like partly tearing. Then what are you going to do? You're going to cut more of it out, and then they're better. No, it logically doesn't make a ton of sense.
Right.
And yes, they are sometimes better, but it is one of those weird things that just, I don't know, like it doesn't really always make sense, and you just have to. It's a frustrating thing to treat.
It's one of the most frustrating diagnoses I have.
Because everybody wants it to make sense, and it doesn't make sense.
Right.
Well, everybody wants it to make sense, and everybody wants, they want an answer. And I mean, my first comment is, this is an annoying diagnosis for both of us, more so you than me, but I don't have the best treatment options for this. And then I go through everything we can do and what we can do.
So then, like, when we think about it like that, right, like all of a sudden, this idea that Stanton has missed a few months, like all of a sudden, all right, maybe not.
It makes a little bit more sense, right? It takes a lot of time to, as you mentioned, use your terms, burn out a little bit, and you can. With that time and some, I'm sure some really good rehab, it kind of fixed some things. And
now, is he 100% better? I don't know. I mean, I was reading an article where he was taking batting practice off the pitching machine to see if he can really hit the high speed stuff.
Yeah.
So he's probably still a little bit questionable with the comfort level himself, but at least he's able to do it. So
right. And I also think it's going to be depending on how they manage his workload too going forward. Of like.
Sure.
I don't know if he's going to be playing tonight. If they have a game tonight,
right?
Or what, like
maybe. He did want to take a break.
Yeah,
be interesting to see.
Yeah, like I don't know how I didn't look it up, or like how he kind of did his rehab stint. With the minor leagues of how many games he played, and how much time he took off, or whatever the case is. But I think this will be the equivalent to like a little bit of baseball load management.
Yeah.
In regards to something like this, which is, I feel like this is just a higher profile athlete with this case, where you don't really hear about it that much. Like.
Yeah.
We don't get tennis elbow out for 70 games. You don't really hear that as often but you get someone on the Yankees, one of the more popular teams in MLB. Giancarlo Stanton, another bigger name.
Right.
Get some news. Get some headlines.
I will say this is, I have the good fortune of not seeing this very frequently because it is sort of a frustrating thing to treat, especially when in reality, lots of times it's just time, you know what I mean? And it's just hard to have people buying into that concept. But when I do see it occasionally, and when I did see it more often previously, I was actually very surprised at how well the 10x10 jet thing worked, where they use ultrasound, kind of look at the degenerated area, and then use a special needle that kind of cleans up or debrides that tissue. And again, conceptually, doesn't make a whole lot of sense to me, but it does seem to be pretty effective. Yeah. And then like, it's not surgery. You're not going, it's pretty low risk thing to
Just a small
undergo.
procedure. Big.
I mean, the recovery is way less than surgery. And
Way
that's
less,
what I
yeah.
always. So I pretty much in my practice I send pretty much if I always try to try therapy first, maybe one cortisone injection,
Maybe
and
one.
then
Yeah, that's how I approach it.
And then I make an appointment with the ultrasound sports medicine guys who can do that and then go that route. And most of the time, I don't see them again.
Right.
Occasionally, they come back to me.
Oh, really?
I've had one or two that have come back to me after that.
Yeah.
And then that's a whole other problem. But yes, right. The new ultrasound, minimally invasive, almost non-invasive needle procedures are much better.
Yeah.
And that's one of those ones where I've had people be like, "This has been a problem for me for years."
Yes.
Like I can't believe it's finally gone. Like it is. It works well. It does. It works pretty well.
Can't beat it. So I think we kind of covered that a little bit good, or not a little bit good, pretty good. And to go into the the big one, we're talking baseball, we're talking pitchers, and that comes
The other side of the elbow.
the other side of the elbow, exactly, the Tommy John or the ulnar collateral ligament, and mild pun intended, but the snake bitten Diamondbacks are having a rough year when it comes to their pitching staff. They currently have 8 pitchers on the IL, and 4 of them are out for the year with UCL injury or Tommy John surgery. Earlier in the year, they had pitchers Jordan Montgomery and Blake Walston go down with UCL injuries. And then just recently, about a week ago, their starting pitcher, Corbin Burns, is out with Tommy John, who just signed a pretty big deal with lots of money just to get surgery and not be playing, which sucks for that organization.
He timed it up well.
Yeah. And so you lose a starting pitcher, and then now on top of it, you lose your closer, who's also out for Tommy John now, and who had spent some time on the IL early in the year with some shoulder inflammation. So it's like one of those things of what came first, the chicken or the egg. Is did the shoulder cause some issue and he started putting more stress on the elbow, whatever the case is. But we can just kind of dive into the world of Tommy John surgery a little bit and then go from there.
So my before we get deep into that dive, I want to circle back for 1 second to Bryce Harper. Is there so it was this, that's the same elbow, right?
Yeah,
that
same
was his
elbow.
right elbow. Is there any chance this wrist pain has anything to do with that elbow being slightly loose from his Tommy John surgery from whatever it was, 1.5, 2 years ago? Well, probably not.
I mean, I doubt it.
Okay.
Not with what's aggravating it. Like, I mean, it was his right. I mean, correct me if I'm wrong. It's his right elbow.
Yeah.
And he bats left-handed.
He does, yeah,
which is really not stressing the.
It closes it down, yeah.
Yeah, the collateral ligament. So now, also on the medial aspect of the elbow is your ulnar nerve, which does give you sensation to that. So, right, I understand where this is coming from, but I mean, I guess anything's possible.
Right.
I'm not going to make a strong stance on this one. I don't know.
That's a big speculation.
Yeah.
Very, very, very big speculation. But yeah.
But I imagine, I mean, what was this, 2 years ago now?
Yeah,
I think 2 years ago.
Tommy John, yeah.
But
I
last
imagine-
year, I remember someone running by first base
and he got
clipped
hit.
his elbow.
Clipped his elbow,
and
and
like,
he went-
at what point did the wrist become a problem?
Yeah.
Sorry.
I don't know.
No,
I
I
think that's
conspiracy
a point.
theorists
I don't
here.
know. Yeah,
No.
yeah.
No, I think that's a good point because there could be some kind of scarring or some issue, I think,
Yeah.
with that ulnar nerve. Potentially, again, we don't know. We don't know what it looks like.
And once it becomes, correct me if I'm wrong, once it becomes a little bit lax there, if it becomes a little bit lax, then there's a little more stretch across that nerve, and then
Sure.
the nerve gets aggravated here and there, and you can feel that down in the wrist. Yeah,
You
I know.
could, but I don't know that it would be. I think it would also go into the fingers and
Right.
For sure.
it
Of
wouldn't
course it
be
would.
So
Yeah,
localized over
yeah.
the wrist.
It would absolutely would go in. Yeah.
I mean, I
two
do
fingers.
appreciate your point, but I don't know. I mean,
Okay.
I don't think anyone knows.
Understood.
I would say if I was a betting man, I would bet against it.
Okay. Fair
There you
enough.
go.
Fair enough.
That's a good way to put
All
it.
right. So then, all right. So let's get. And we had you on. Was it Bryce Harper? We had you on to talk about Tommy John previously.
Yeah.
Yeah.
I think it was Brock Purdy,
Brock
right?
Purdy.
Brock
Right. When I
Purdy,
said I
that's
don't
what it
know.
was. It was Brock
Yeah.
Purdy.
When I said I didn't know if he was going to come back the next year.
Yeah.
That was it. Yeah.
I feel like everyone remembers
missed
when
a
they
few.
make poor predictions
I
on
know.
our show.
It
Like, we
happens.
do it all the time.
It happens.
But no, I think it's just something that's interesting in that, like, so in the, I didn't even talk about the second sheet I gave you guys. Just on the second piece of paper,
I didn't even know there was.
a second piece of paper today. These numbers that I have printed out, I don't know. Again, I hope it's a reputable source, but these numbers are pictures that each team used last year that had a history of Tommy John surgery.
It's an epidemic.
Wow.
And, just to go off the top ones, the Dodgers had 18, Yankees 17, the Colorado Rockies 16, Detroit 15, and the list kind of trickles down all the way to Seattle at the lowest with 6. So there's a total of 307 pitchers that were used, and across the board, that's 38.5% of all pitchers in MLB have had a history of this.
Right.
And I think I saw somewhere earlier today, too, when I was reading some articles that, like, it kind of has an upward trend about, like, 9% more Tommy Johns per year. It's
9% per year. No, that can't be right.
That's
how
what.
How can that be?
Well,
I don't know if
It
it's
would have crossed
directly-
over 100 a few years ago.
Right.
Okay. Yeah. Yeah.
I-
But I
I-
believe you that there's more every
Right,
year.
There's
right.
more every year. I mean, I've had patients. I mean, this is purely anecdotal. I'm sure you've talked about, little league and younger baseball
Yeah,
pitchers
yeah,
who
yeah.
just play and play and
Right.
play and pitch and pitch and pitch.
It's a problem.
Yeah, I've had patients who come in with the recommendation from their coach to get surgery, even though it's not torn,
Yeah.
or completely torn, or it's a
Yeah.
partial sprain or a partial. And I don't recommend it, but you're fighting against the they always know the one guy that got it fixed and was better than ever.
Right.
And there is some of that out there. I'm not, saying that's the reason for these numbers.
Right.
I do think the reasons for increased numbers
I see your
is
point,
the it is the the travel system,
Yeah.
Right.
and
Year-round baseball.
one travel team doesn't talk to the other travel, and so when I have a player that plays on 3 different leagues and pitches, each league does pitch counts, but they don't care what the other league did.
Right.
4 hours before the kid got there. So,
Exactly.
that I think that is the epidemic of
Yeah.
little league and younger pitchers.
Yeah.
And it just builds. And so by the time they get, they may have had elbow pain nagging
Right.
forever. I mean, I just did an ulnar collateral ligament on a kid. He was a senior, had pain all of his junior year. stopped pitching or stopped throwing. Had no pain. Went back his first week of March baseball.
Yeah.
Threw a couple times, snap.
Ah.
And but that's been building for years. I mean, this is not
Right.
something you get. He didn't even it wasn't full velocity pitching. It just this is. I always tell you, it's an attritional. I mean, the ligament has been just getting beat up. It's weaker until one day it just snaps.
Yeah.
So I imagine there's some of this in there.
Yeah.
Like
Right.
I mean, although I don't know how many of these guys play in college. I don't think college has the same repetitive nature, but it's probably a year, if any, in college, or just minors, and then they're into.
When I was doing my fellowship, and again, I don't know if this is a true statistic, and maybe it was at one point. I don't know if it still would hold true now, especially because pitching year round is somewhat becoming ubiquitous. But at that point, when in my fellowship, we took care of the Pittsburgh Pirates, and so we were very, very involved from a baseball standpoint. And my fellowship director had said, and again, it was hard for me to believe, but I've never seen this stat myself, but he was pretty definitive on it that more Major League Baseball players come out of the Northeast than any other region because of the weather, because it's harder to pitch year round, and because fewer people wind up with having their careers derailed before they meet the majors.
Yeah,
that is very interesting.
So again, I don't know if that's true. I'm just
well, no, because that makes sense, right? Because Mother Nature's in favor of that. Because when it's cold out, no one wants to go out there. Whereas like when it's December here, no one wants to go outside and throw around. But when you're in Florida or Texas, you can go have a long toss any day of the week.
Year round.
Every day. Yeah.
No, that's interesting. That's a good. That's
and
a good
I think
point.
I was talking to my boss about this at work a little earlier today of just the thing of Tommy John, and she was just kind of going on a little bit of a tangent of like, it makes sense to do it earlier on and do it more often now because it's such a successful surgery. Like you have a good outcome.
It's way better than it used to be.
Right. Yeah. And like, why not invest that time now, get it fixed here with it, then deal with a nagging elbow injury that you have to kind of ride the roller coaster. If there's micro tears in it, it's going to only kind of get worse. Right. And then you tie in Major League Baseball business side of things, where like, on our list, is the Tigers' young prospect Jackson Jobe, who's also out for the year with Tommy John. He's only 21 years old, so shut him down for a year and a half, 2 years, get him right, and then you have him for the back end. When he's 23, he's coming back.
Yeah, I mean, I think that if that's your livelihood and there's obviously a lot of money involved, it's a no-brainer.
Right.
I have a lot of conversations with players and parents in their sophomore, junior year, and I'm like, what are you looking to do?
Right.
And this kid I just fixed, he's like, I just want to be able to throw with my kid one day. And I'm like, all right. I'm like, because the expectation that you're going to be able to get, you're already a senior. You missed out on that year. You're not playing in college. Like, what is your expectation?
What's the end goal here?
Yeah. And he's like, I just want to be able to throw with my kid one day. I'm like, all right, we'll fix you up. You'll be fine to throw with your kid.
Right.
Yeah.
Right.
But everyone has this expectation. I want to go all the way.
Yeah.
And
I want to be better than I was before the
better. Yeah. And then when you're there, right, it's a no-brainer. I'm already here. There's money in the bank. I could make more than go for it.
Right.
Because what's the alternative? You're just never going to pitch.
Career's over, yeah.
But as a sophomore in high school, then it's a whole other conversation.
I worry about those fringe, like you were saying, the fringe guys, right? That to come in with the idea of like I'm gonna be better. We've talked about this in the past, and we're like maybe go through the whole rehab protocol rather than the surgery.
Yeah.
Because maybe that's the difference in getting you a little bit better or faster.
But I think that's the silver lining of like the Tommy John surgery.
Yeah.
Those 12
You're
to 18
forced
months.
into that.
Right.
Yeah.
You got nothing else to do but fix all of these mechanical problems with your shoulders, your scapular issues, all X, Y, and Z.
Strength.
All that stuff. And like, I don't know, no one wants to invest this in making this a study, right? But if you took those guys with those beat up elbows who were questionable surgeries and you just gave them the 18 months and had them rehab and fix all this stuff, would they still be better without actually going to undergoing the procedure?
Yeah.
We won't really know that, but it's like what's really helping is like obviously fixing the structure is going to help, but like that rehab and taking that 18 months of like we were talking about a little league kid who's playing in 3 different travel leagues, pitching all weekend long.
Right.
Give that kid a break or whatever.
Just give him a break.
Yeah, just give him a break and let him rehab and fix all the things that he had problems with, and there you go. And then the problem's kind of solved itself, but no one invests that much time.
Now, on the flip side of that, the counter argument, the devil's advocate here is, you know, I remember actually having this conversation with Greg Burke, and when we were talking about this a little bit, and how many times is it like, oh, forearm tightness, forearm flexor, blah blah blah, and you're like, as soon as you hear it, you're like, oh, Tommy John's 3 months away.
Yeah.
Like you know where it's headed, you know
Yeah.
how the story's
Right.
going to end, and it happens. You know, like, I don't want to say 100% of the time, but like often, very, way more often than should
Well, I
be.
mean, again, just like you said, right? Like, again, to bring up Tigers Jackson Jobe, on the 31st of May, he was on the IL for a flexor strain. And then just 11 days later, he gets reported that he's undergoing Tommy John surgery.
Yeah,
So it's
yeah,
like,
yeah. Is it really a
same
flexor
thing, right.
strain or
Right. Yeah, absolutely.
Yeah.
And then I think even kind of recently, but I haven't heard as much, but I also don't work with the younger athlete population as much as I do college now, but that assumption that like getting it early is better because
Yeah.
you start throwing faster.
You- it-
You know, like,
there is that misconception that I'll get this, I'll be better than ever.
yeah, get it done now, then I don't have to
Yeah.
worry about it like later on.
Yeah. And
And the good thing about young kids, I mean, they do heal phenomenally well.
that's
I mean,
that is a really good point.
oh yeah, I
Like,
mean,
they feel so much better than.
I mean, I see these like 15-year-olds that I'm like, oh man, you look better than I would have thought.
they do no wrong.
6
man.
weeks.
Doesn't
I mean,
matter. Like, they're just better always.
Yeah.
But the numbers don't bear that out
Right.
long term. But yeah. I mean, I certainly understand, and I don't know what I would have done if I was a pitcher at 15 and have
Yeah.
this. I don't know.
And if you do have that potential, like I get it.
If you have the potential, yeah.
Yeah. And again, if there's money on the line to do these things, then you got to make a quasi business decision
Yeah.
here.
Yeah.
And same thing with these bigger teams. Like, all right, we know this guy is going to eventually blow out this elbow. Let's just get in there, fix it now, and invest these 2 years for Jackson Jobe for, he's going to probably be
Right.
out all of next year.
Yeah.
And they're going to just eat that up, and then they got them for the back half of it. And he's still going to be 23 years old, and he's still a high prospect. So there's plenty of upside for that.
And sometimes it's not even just like the money. Like, oh, I'm going to make the majors. I'm
Yeah.
going to make a ton of like. Sometimes it's the stepping stone to help you get into that school that you weren't
Right.
going to get into otherwise. You know what I mean? Like
Yeah.
like it can be life altering in some ways. And,
Oh, yeah.
And like just
Exactly, and
You get it.
I think we skipped the importance of, and I think unfortunately that's kind of like common practice now, skipping the importance of college as a whole, where it's like
Right.
in the world of sports, because all the one and dones, and in
Right.
the world of basketball, they're 1 year and then they go right into the draft
Yeah.
or whatever the case is.
everything's changing now, man. It's
And
crazy.
then NIL and all that other stuff, that's a whole nother ball game.
Yeah.
But
I always have a conversation with my patients and my parents when they come in with an injury. I'm like, all right. They're like, there's a big tournament. I mean, there's always a big tournament.
Always. Yeah.
All
And
the
I'm
big
like, all
scouts
right,
are
is
coming.
there scholarship potential or money on the line?
Yeah.
Or is there a championship? I mean, I let a kid with a metacarpal fracture, 2 weeks out, play in a high school championship game. I'm
Yeah.
like, hey man, your scholarship risk here, yeah man, I'll club you up and you go play.
Yeah.
But if there's nothing on the line, then
What are you doing?
Then what are you doing?
Exactly.
So I always ask that, but there's always, in their minds, there's always something on
Always.
the line.
Yeah,
but
yeah.
That's something you have. I mean, in the professional world, that's different, but in the non-professional world,
Yeah.
that's because what you'll see on the back end is guys in their late 30s and early 40s who are getting arthritis.
Yeah.
And they're like, if I could go back
Yeah.
and talk to my younger self,
Yeah.
I would have gotten this fixed or not done this or not that, because now I'm in pain forever. I can't fix the cartilage that worn away.
Right.
And I think we all deal with that a little bit. So that's what you try to protect.
for sure.
So, but these
But-
professional guys, but yeah.
And as a doc treating an athlete, like I don't think people realize it, but like you're coming into it with that mindset, like you understand, like that. Yes, the championship game or the senior,
Yeah.
like these are important events that we really don't want you to miss. We're not
Right.
just so if there's any way we can keep you going or get you into it, that is our goal within reason, right? Like it's not going to compromise your entire future. Like at some point, we have a role of stepping in and not letting you hurt yourself.
Right.
But if we can get you through it with the little
I
bit
will,
of risk,
right, with a little bit of
That's
risk.
okay,
I will
yeah.
take a stretch. But
Yeah.
what I always found is funny is the dichotomy between the professional sports and amateur. Like these high school kids will do anything to play.
Yeah.
Meanwhile, you get a little tiny touch of something as a baseball player. All right, you're out a couple weeks.
Yeah. Yeah.
Basketball. All right, we need some load management here.
Soccer.
We're gonna sit.
For the love of
We're
God.
gonna sit you for a few weeks. I know you got a touch of like a tendonitis.
Yeah.
Meanwhile, you get tendonitis in high school. We're like, all right, you're doing the 2-a-days and you're playing, and we're like, it's.
Different.
Once you get there, then they care about your body. Until
Right.
you get there, they don't care about your body.
But maybe that's why they got there. Like,
That's right.
honestly.
Yeah, that's right.
Right. Yeah, 100%.
Yeah. Once you get there, their body is a commodity. Before that, you just see your own.
Do what you can.
Yep. So we touched on the good old Tommy John a little bit, and then we kind of briefed on it a little bit of the non-surgical treatment for elbow injuries, very broad term. But in regards to the Major League Baseball, we had some reports of the Pirates catcher Endy Rodriguez. He was put on the 10-day IL back on the 7th. And then on the 13th, he got reported to get moved to the 60-day IL because he was undergoing a PRP injection in his right elbow. And per the report, he was going to take 4 weeks of rest and kind of progress back. Similar story with the Mariners pitcher Bryce Miller. Last week was reported to be on the 15-day IL with inflammation. He was stated to, he has a little different. He was stated to have a bone spur in his elbow, was initially treated with a cortisone shot, was deemed wasn't helpful, and then on the 10th, about a week ago, he received an injection, a PRP injection for the bone spur, and the same thing, no throwing for 2 weeks, out 4 to 6 weeks. So let's dive into talk of a little bit of PRP injectable for treatments for the elbow.
I feel like it's a great place for it. It's one of the, PRP is kind of controversial, sort of across the board still. I'm more of a proponent. I think that it can be helpful, and this is, I think there's enough data out there that is supportive. The problem is, the data's all over the place and whatnot, but the one place where it does seem to work pretty well is the elbow, right? Like for lateral epicondylitis. Another one of those things. Why? I don't have a great answer for you, right?
Yeah.
Like some of the logic there is right. Like so, kind of the underlying philosophy with PRP, platelet-rich plasma PRP.
Mm-hmm.
Draw off your own blood, spin it down. There's one layer, the plasma layer, which has concentrated platelets in it, right? So let's say you cut your skin, right? And when you do, platelets come into contact with oxygen, and what do? They break down and they degranulate, and they release all of these sort of growth factors and all these things, cytokines that bring in, cells and things to heal it. And the idea was like, all right, well, if we concentrate them, put them at the site of an injury, maybe that'll increase the healing capacity at the site of the injury. And I don't know that it's necessarily fully worked out quite that way, but it does seem like lateral epicondylitis is kind of like the golden child of that treatment. And there's a few other areas where it works very well, but I'm a proponent, and actually it's at this point, I almost don't even I don't necessarily do it. I do PRP injections, and I did a fair amount of PRP and stem cells and whatnot for a little while, but I don't do them quite as frequently anymore. But I actually, when I send someone to one of our primary care sports med docs or non-op sports med docs for a 10-jet procedure, I kind of say like, hey, they're probably going to offer you PRP as well, and like just roll it into one. Just mix the two, because I feel like, and I don't know. I don't know where you draw the line, which one is actually solving the problem. But I my gut is that it's probably both, right? Like the two of them are probably together, adding some benefit. But I don't know. What are your thoughts? Do you ever do PRP?
Well, yeah, I mean, I similarly send people for PRP injections, and I discuss it with them. I mean, from the problem with PRP, in my opinion, is that in most insurances, if not all, don't cover it.
Yeah, that's always the issue.
That's the biggest hurdle.
So if you look at the risk benefit, now, if you read the studies that have been done, there's always risk, right? Anytime you draw blood or stick a needle, there's going to be some risk, like pain
anything.
But what I tell people is the only risk is the needle. I mean, the pain from the needle.
Yeah.
You're
or
taking
into your wallet.
Right, and your wallet. You take your own blood products out, you spin it down, you inject it back. Theory being, it's going to encourage healing. And if you look at tennis elbow or lateral epicondylitis for an example, the theory is, micro tears start, and then this whole degenerative process. So if you can heal the micro tears, you could fix the problem. So I see no downside in it. But the data on PRP injections is not good. for tennis elbow. I mean,
It's funny because my impression is that it is good. Like it's mixed, but that's one of the places where it works well.
it's not great. I mean, the stuff that I've read, unless something's came out ultra recently that I haven't seen, it's not good. It works exactly opposite from cortisone. I think there was a PRP versus cortisone study, and the cortisone, you get better right away, you have no pain, and within 2 months the pain comes back, and it's a kind of pain drop off and then slowly increase over.
Returns, yeah.
And then PRP does the opposite. And this is what I
Right.
always describe to my patients. You probably have more pain initially.
The first 2 weeks are worse.
And
yeah.
then slowly over the next couple of months, it gets better. And I have had patients that have had that experience as true. And there's no downside. I mean, if you come up 2 months later and you're still having pain or it's not better, or it's worse, I mean, you're right back in where we started from.
Right.
So, but the money tends to be, I think if insurance has covered it, I think you could do a great, you could do a great number of patients and do a good study on it,
Yeah.
Right.
even retrospective or whatever. But the fact that, I mean, so few of my patients choose it because it's a lot of out of pocket.
Right.
Right.
But yeah, I mean, like I said, risk benefit is
Right.
there's almost no risk in my opinion, other than the money. And the benefit is the potential. But I think the data that I've read is not great on this for tennis elbow. I mean, I think I mean, you do other things. Do you do it for like partial rotator cuffs or?
So I don't do it that frequently anymore, but I do it occasionally here and there. If somebody's specifically asking for it, actually, the data on the rotator cuffs isn't great. It's okay for partial. For full thickness,
Sure.
no.
Right.
No. And again, I don't understand the mechanism of how it's working, but it actually works pretty well for osteoarthritis, right? So it's
Right.
It's actually tennis elbow and osteoarthritis seem to be the better ones. Patella tendonitis, it works pretty well to a smaller extent. Achilles tendonitis, like some of the tendonitis, those type of things, which it seems to work very well. Doesn't seem to work as well for tears, right? And yeah, that's kind of been
Right. Complete tears. Yeah,
complete
sure.
tears, right.
So it's mixed. I mean, certainly there's no universally accepted. This is a gold standard.
Right. And
but-
I think the accessibility to PRP, if that improves, then I think we get better data for it and have a better understanding of it across the board. But like you said, like you have arbitrarily, you have 10 patients, you suggest PRP to them and only 2 of them get it, then like,
I mean, I offer it. I mean, I don't do it because I
Right.
also send them to someone who does it under ultrasound guidance. If you're going to spend the whatever it costs,
Make sure, yeah.
make sure
Right.
it's in the exact right place you want it. So I send them to the sports guys that do ultrasound guided injections, which I do not do. And some of them choose to get it, and I've had some patients that they do get better, but again, they get better slowly over 3 months. And if you're talking about tennis elbow, was that going to be the natural history of this
Fair
anyway?
enough. Fair enough. Yeah. Reasonable argument.
then you
but,
play the placebo game
sure,
a little bit,
sure.
right? A really expensive placebo, but
But again, I always say there's no harm in it. I mean,
Right.
You can see why insurance companies have issues covering it, right? Like here we are, like
Right.
two learned guys debating and two separate sides of the standing on two separate sides of the issue, and then especially when it comes to PRP, like it's not just that, but like there are different formulations of it.
Oh,
There are
right.
different
Every
versions, different
company.
companies, different, and then like some have concentrated better, some don't concentrate it as well. Some have or what we call leukocyte rich, some are leukocyte
Right.
poor. Like all these different, and then there are different protocols. Some people say don't take any aspirin. Some people say it's not a big deal. Some people like there's all these different other issues. Some people will do it with a cortisone shot. Like, is it really the PRP or is it the cortisone? Like
Yeah.
there's a lot of different factors
makes
that are
sense.
involved. Yeah.
I mean, from a just philosophic standpoint, I always think of them as completely different treatment options.
I agree with you. Yeah.
I tell patients
Same,
if you want to.
hopefully you're trying to get the same end result, but you're getting there through a totally different,
I always tell
pathway.
patients cortisone, although we describe it as a potent anti-inflammatory steroid, it shuts down everything.
Yeah.
Any healing process going on,
Well
it
said.
shuts down.
Yeah.
So if you're injecting a pro-inflammatory healing agent with an anti-inflammatory
That's exactly right.
non-healing agent, what are we doing?
Yeah.
So
it's
I'm like,
opposites.
if you want to do
Opposites.
one or the other, don't do them both because I mean, there's been no studies or data on this, but it's just the way the mechanisms are
Logically.
completely
Right.
opposite.
logically right.
So I wouldn't recommend them together.
Yeah.
No, that makes sense. Yeah, I think that's something to see, like, and see how these kind of follow these stories a little bit. I mean, 60 days out, they have a chance of coming back after this kind of deal towards the tail end of the season. We can follow up with them and kind of see just like what their story is and how they go, and kind of see how they kind of take to. And I think just kind of see how it goes. But like you mentioned, at least for, again, to kind of go at least treatment algorithm, if you will, for Bryce Miller, like it said that he had the cortisone shot first, didn't really help. And then now he's going for the PRP route.
Yeah.
That's relatively that's not that there's a standard, but that's kind of like the standard order of operations, right?
Yeah.
Like you
Yeah.
try
Sure.
that first.
Yes.
Not at the same time.
Not at the
Right.
same time, right? Like,
Spaced out.
yeah.
Before we go into anything major, I mean, I'm like, look, there's no real downside
Yeah.
to doing a cortisone shot. I think one shot is safe. You're not going to.
I agree with you.
I'm like, so
People freak out about
and
it.
I
One
have
shot.
patients that have had, they come back 5 years later. They're like, my elbow flared up again. You gave me a shot for tennis elbow, and I was cured for 5 years. I'm like, hey,
Magic bullet. And
I'll
sometimes
do it
is.
again.
It is a magic bullet.
Yeah.
Yeah.
So I don't see any. Doing it, every
5
few months for
Yeah, right?
4 years.
Probably not doing it the best
Probably
thing for
not
that
doing the best thing. But doing it once, I think, is fine.
Yeah.
So I before you do anything drastic or keep this guy out or give him one, see what happens. Because when the pain comes back, it usually comes back pretty quickly, like 6-8 weeks, and then it's starting to come back.
And there are people at this point now though where it's been so bashed cortisone that like they would rather take risks of surgery rather than like try a shot and then
I would probably say I've never done surgery without doing a shot.
Yeah.
And I have had patients dead set on not getting a shot, and I'm like, look,
try one.
there's no harm, and if there is, there's nothing I won't address at the time of surgery.
Right.
Right.
And you might be one of the guys, gals, patients that gets better after a shot, and I don't have to do surgery. So I would recommend at least one before we decide on operative
Yeah.
intervention.
And you're a surgeon, right? Like
Yeah.
Right.
you like doing surgery. Like this is all on their behalf. Like it's not like I don't have to do surgery. It's more we're saving you
Right.
from the risks
potentially,
associated with
yes.
surgery. Like
Yeah,
that.
'cause
We're
surgery's-
helping you. Yeah.
It's not 100% perfect thing. Like
You
you,
never
said,
know.
we just talked about the risk of just a needle prick of some sort,
Right.
let alone a surgery, right? Like,
Yeah.
so it certainly goes into that. So I think another thing, just specifically to the Bryce Miller thing, what are your thoughts on the bone spur of the elbow being treated? Is that common practice for the cortisone? Is and do you, I guess, hopefully a better outcome than your Brock Purdy estimate? But what do you think his outcome's going to be due to having a bone spur and getting treated that way?
Well, where is the bone spur?
Right.
Is my question.
Yeah.
So in all probability, right? This is your standard valgus extension.
Right.
of a low
Yeah, if
depth
it's
thing,
that
right?
and there's
Yeah.
a bone spur on the olecranon
Yeah.
from impaction into the
Yeah.
humerus from valgus. I mean,
And we don't know this, but I'm pretty sure that's exactly
right,
what
that's
Right.
what I was thinking.
Right, based off his position.
Yeah. Yeah.
So a cortisone might take the inflammation away for a while, but that will come. I mean, that's something.
Yeah.
Unless you address the issue.
He's the idea would be get him through the season.
Yeah.
It does blow my mind sometimes when these guys they can't get their elbows straighter than this, yet they can still throw a ball 95
Yeah.
miles an hour. Like
Yeah.
it is amazing at
Yeah.
times, but eventually it does seem to catch up with them.
Yeah, right.
Yeah.
So they didn't describe where the bone spur is.
No,
and
no.
so, but assuming it's a fissure and it's off the the olecranon
Right.
valgus
Yeah.
overload,
Yeah.
it'll take away some of the inflammation and pain, but the mechanics are the same. The instability or whatever you wanted to call it is still the same,
Yeah.
and this will
Yeah.
probably rear its head.
So yeah, I think in all probability in that scenario it is a temporizing measure.
Yeah.
Um,
Yeah, and I
but
think based
probably
off
not the solution.
Based off the article, they kind of alluded to this is what we're trying to do to avoid surgery. For
Right.
this,
Right. Yeah,
for
sure.
him at all costs. If we have to, I think they may address it in the off season. But again, like you said, they're going to try
That's
to
where
get
I
him,
would see-
get him back in the season of some sort.
Yeah.
And then off script and before we kind of close out here, just again elbow related is Shohei Ohtani made his first start.
Saw
Oh,
that.
wow.
That's
He pitched one inning, I think, per his rehab protocol. I think he went just under 30 pitches. I think he let up one run or whatever the case was, but he still tapped over 100 miles an hour on his fastball.
Did he really?
Wow.
Yeah.
That guy is amazing.
And then
So how long is it? A year and a half? 2 years?
Yeah, he didn't pitch all last year. I don't
yeah, I
think.
know.
They
And
gave him
then
time, yeah.
They gave him plenty of time. And then even the manager was like, I kind of wanted him seeing around 97, but then I didn't really want to see the 100, but he did it a couple times, which is great. But
yeah.
this is still only a one inning start, so we just want him to get out there, get his feel. And then he goes and bats and does well. Just what a freak of an athlete he is. But
Yeah.
I think that goes into, we always quote these recovery times, especially with Tommy John surgery, which, I'll put in quotes here, a year, year and a half. But it takes a long time. I mean,
Yeah.
until it's till your baseline, everything's status quo, no inflammation, no healing, everything's solid. It's probably a year and a half to 2 years.
Yeah.
But people are coming back quicker than
They
that.
are.
They're just not fully there.
Right. So I think that's. I mean, I did see that, and that's awesome.
Now, when I saw, because I saw it, and like when I was looking stuff up, they just said he came back, and I read briefly, and I was like, he tapped over 100 already. Like this guy's just like phenomenal doing what he's doing, and then I was like, yeah, he had a 1 inning start, went out there, did his thing, came done, and then he batted the rest of the game. So
Is Paul, again, speculation, right? Is there any way Paul Skeens is able to keep it up? Do you know who Paul Skeens is or no? On the
Pittsburgh
Pirates?
guy. Yeah,
right.
Pirates, yeah.
We're like, it's like, a third of his pitches over 100. Like how? Like, it's incredible. Like, I hope he does.
And
I
it's
hope
just
he
crazy
does.
the trajectory of just velocity of a baseball. It's just
Yeah.
like the way they can do it more often, more
Right.
like
If you could crack 90, 20 years ago, you were making the majors. Now, like,
Yeah.
if you can't
Right.
crack
Yeah, like,
98, you're
I don't know,
like,
what, 10 years ago, Aroldis Chapman was like the big, oh my God, he's hitting 100.
Yeah.
He's like one of like 30 guys who can do it now.
It's like every
it's-
day. Yeah.
Yeah, I mean, I think what's concerning is when you look at the number of Tommy John surgeries and injuries. I mean, to eke out that extra mile an hour, especially as you age, when your shoulders, your core just drops that much, you get that extra.
Yeah. Little more stress.
A little more stress on the ulnar collateral ligament, and then it starts to go.
Yeah.
So I mean, that is the concern. So, but I don't know. I mean,
Yeah.
I don't know how anybody throws 100 miles an hour.
Yeah, it's unbelievable, right? Like
So crazy.
certainly I can't do it, but good for them, for them being able to do it for sure. So any last closing remarks or anything? We went all over the place.
Stocks for that.
Yeah. Amen to that.
I like the Jamie Moyer 48 mile an hour breaker.
Right.
At 48 years old, he's
Just
lobbing one over there.
Right.
Hey, it worked, right? So before we go ahead and close out our tab, one, thank you, Dr. George, for coming back on. Hopefully
thank
we
you.
can go
Sorry,
little
it's been a year.
shorter than a year.
Get you on
that's quite
sooner.
all right.
And then just a quick shout out to our sponsors, Virtual Orthopedics and Spine. From runner's knee to dog walker's hip, they have a doc for that. Yard work, back, and laptop wrist, they have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho. Neck of the Woods Brewing Company giving us the best beer in all South Jersey. And our guy Brian behind the bar always helping us out. And Timber Real Productions getting us all this stuff out to all of our fans and our audience. So we appreciate you, Kyle, over there. And we'll see you next time, folks. Have a good one.